when you learn, the other problem is you forget. So we have had pandemics in the past, and we've forgotten some of the lessons we should learn. I'm afraid we may forget the lessons we've learned. But let's talk about one of the most important lessons to me. It's that we're not separated from the natural world. We're part of it. And you can't separate a human being from our environment. And part of our environment are diseases. And the diseases are adapted to us as we try to adapt to these diseases. And there are different ecological niches for diseases. I think what's different now that we've learned is that we are now a new ecosystem. There are now 8 billion human beings. We live tightly packed. There are 5 billion airplane rides, individual rides, a year. We fly around like bats. And we live together, and there are a lot of us. And that's perfect for microorganisms. They're adapting to us. So it isn't that we're encroaching on their environment. We are the environment, and it's new. When I was born, maybe we were 2.5 billion people on the planet. There are now 8 billion. And so we are the target of choice, and we have to learn we're the target of choice for new organisms. We know that they can come to get us, but they're happening more and more frequently. So the first lesson is we are now at higher risk than we've ever been, and so we have to start preparing. And I don't think that's a lesson that most people have internalized, that we're now at much higher risk than we were before. You can tell by my gray hair, I've been around for a while. And I was one of the first AIDS researchers. And a lesson from AIDS was a disease that starts in Africa can be global very quickly. And I talked about that. I said, this is not the first pandemic we're going to get. It's not the first time that we're going to have new diseases. We have to start preparing. We need to have surveillance, and we need to do research, not just on this diseases, but many diseases. We have a list of many of the viruses that are likely to get us. We really need to know what they are, and we need to have countermeasures. And did we listen to that? We developed the countermeasures for HIV. It's not possible to eliminate HIV. Botswana has done it. A few countries have done it. But what about the other diseases? We didn't. Now, let's talk about what we could have learned. We knew that there were coronaviruses that cause colds, just like influenza every year come around. We knew about SARS, killed 10% of people. We knew about MERS, killed 35% of people infected. We knew these were there. Did we do research on them? No, we stopped. I can tell you, I know a lot of people who are doing research, no money, no research. The space people always say, no bucks, no Buck Rogers. I can say, no bucks, no vaccines, no protection. And we're forgetting again very fast. The money that should be going into protecting us from many other viruses isn't there. And the people I know, and I'm in touch with the top people in the world working on this, are running out of money. Well, that's fine for this. It's not fine for this, but it's not fine for a lot of other viruses. There are things we can do. We are not doing we're not using our best brains and our best money to protect ourselves. That's without talking about public health services, which are very big persistent problems. Why we're here today, because you don't just need the drugs and the vaccines, you need a system to deliver them. Way forward is for massive funding, relatively massive funding, for antiviral research, not only on vaccines, but on drugs. Drugs are much more reliable. Take a pill, you don't get it. Vaccines for this kind of virus that affects adults generally don't work. Or if they do work, it takes a long time. Some vaccines work very well for childhood diseases, mostly, because the viruses have evolved to what I call infect the fountain of youth. All this new youth that comes every year, predicted. But that's their niche. It isn't the ones that are going to come to get us. The ones that are going to come to us are like the flu virus, the coronaviruses, and a number of others that affect us as adults. So we need to do that research. And I don't see it being done properly. I don't see anybody in the world organizing to do it. And you know, fortunately, compared to when I was young, we have huge expertise. Here in India, you have the technologies and know-how to do that. China has it. Europe has it. Japan has it. When I was, you know, a young scientist, the United States had it, Europe had it. That was it. Now, you know, we have very powerful research centers and technologies that we need to employ. And so it's not just one country doing it. The world has to get serious about this. I don't see it happening. I have seen, I think all of us who have been interested in what's happening have been very disappointed in global structures. Everything we tried to put in place really didn't work. Vaccines were not available except for countries on a country-by-country basis. India was fortunate. They put a lot of research into, not research, but a lot of resources into their vaccine, and you're one of the best vaccinated countries, and you should take credit for that. But neighboring countries didn't do anything. Global collaboration is almost an oxymoron, except for economic interest. It's very, very hard to get people to collaborate. It's an aspiration. There are many people with goodwill that want to do it. But you have to say that when you actually look at the reality, it's power politics. And real politics, you know, I think they call it realpolitik. You have to have a pretty clear eye if you're going to try to cooperate across a national border. Sometimes you can do it if it's in everybody's interest.